Hello ladies and gentlemen, this is Mohammad Bilal Majid and I welcome you all to my presentation on remote health monitoring. I am studying in University of Wollongong and currently I am a student of Masters of Electrical Engineering. So before I formally start my presentation, I would like to tell you that what is remote health monitoring. RHM or remote health monitoring, as the name itself suggests, is basically health monitoring of a patient, of a user, of any person outside the facility of medical environment. So now the question arises, what are the factors that basically leading us towards the innovation and invention of remote health monitoring? Or you can say, why do we need remote health monitoring in today's time? So the researchers over the years have shown that advances in medical science have been increased dramatically. That is ultimately leading towards a larger life expectancy of the people. And according to a latest research conducted in the year 2015 and 16, the average lifespan of a person is up to 75 years of age for both male and female. So this is leaving a lot of aged people in today's time in our planet. So we can say that nowadays maximum number of people globally are aged people. So with the increasing aging population, there is an increased need of remote health monitoring systems as well. So now the question arises, what has the work done so far in this domain? So based on the researches conducted so far, so number of authors have researched in this domain and some of them successfully were able to devise smart remote health monitoring systems. But there are some issues with remote health monitoring systems as well that the research conducted so far outlined. Some of them are health data security, design adaptability, and ease of operation. So now the main thing is, what is health data security? So whatsoever data is generated by the user should be safe and secure, because this is a personal information and privacy of that information should be respected by the system and its working. Secondly, the design of the system or the architecture should be very adaptable. I mean, it should be operating easily and it can work under changed environmental conditions as well. These were some of the main issues that were outlined, and my proposed design to an extent tries to cover these issues. So this whole scenario led to a need to devise a smart RHM system that caters for these issues and every other issues outlined by the researchers conducted so far. So now I'll speak something in the upcoming slide. I'll speak something about my proposed design, and I named that design as smart RHM system. So as the name itself suggests, smart RHM system is basically a combination of smart sensors that is collecting users' physical data. That is the vital signs of the user. Now what are the vital signs? Namely your blood pressure, your blood sugar level, your weight, your body temperature. These are some of the vital signs that are critically monitored by the medical experts in order to provide timely healthcare services to the person in need. So this data, when collected, can be uploaded to the cloud with an encoding for 24/7 availability for the medical experts. So the main thing that distinguishes my design from the other design is that it is catering for the safety at the very first stage. Like when the data is uploaded or data is generated, so it is uploaded with a safe encoded system, so that immediately after generating the data, the user should be feeling satisfied that his generated data is safely uploaded and would be safely decoded only by the relevant person, that is the medical expert in this case. So this generated data is then compared with the threshold values, generating alerts and providing user with the immediate feedback. So the threshold values are basically the vital sign information of a normal healthy person of that age group. Like for example, if we are dealing with a person of an age group between 45 to 55, so the threshold values would be the normal blood pressure, blood sugar level, as I said earlier, body temperature and other factors of that normal person. So that normal data would be our reference data, and based on that reference data, the user generated data would be analyzed, and then the alerts would be generated accordingly. So this is another smart feature of my design, that it generates immediate alerts. Like what if the data after comparison to the threshold gives a positive alert? So everything has a meaning. Similarly, what if the data after comparison to the threshold is giving a negative alert? So positive alert basically for my design means that the data generated by the user is 10 to 20% above the normal threshold, that is the value of a normal person. So this is a major alarming thing, that is generating alert for the user to stay active and to stay calm and to take hold of the situation, and at the same time this alert is alerting or notifying the medical staff as well, so that they should know that particular person is in need and requires timely healthcare service. So in the case of negative alert, is basically that is notifying the user only that your data has been generated and it has been analyzed and compared to the normal threshold value, and there's nothing to worry about, and the data is under the safe limit. So this is basically negative alert. So a little bit more about my smart RHM design. So medical experts on the other end of the architecture have complete access to the data. So this access would be given after the data is decoded as per the user's profile in the database. That is another added safety feature of my design that makes it very distinguished and a tremendous revolution in the field of RHM, because we are catering for the security two times. One, when the data is generated, and the second time is when the data is about to be read or decoded. So based on this scenario, prompt analysis of the data ultimately is leading towards the prompt medical attention given by the medical experts on the other hand. So like for every design, my design also is coming with some pros and cons, but the positive aspect of my design are outweighing the negative aspects of my design, such as my design is very easy to operate, it's very adaptable, and it ensures timely medical attention. Adaptable means the design could be used in any working environment without the calibration of the sensors. So this thing is ultimately making my design very cost effective as well, because a lot of other designs and the sensors in the design need to be recalibrated as per the changing environment conditions as well. So my design, as I said earlier as well, introduces safety at two times. So this means my design is comparatively more safer as compared to the other designs available in the market. So a little bit about the negative aspects of my design as well. So it's, as I said, that uploading the data would be done through uploading the data on the cloud. So this basically ultimately leading us to the more resource usage. So as compared to other designs, so my design would be using a little bit more MBs of internet. Plus the commercial feasibility of the design is also a little bit different as compared to the other designs, because the initial implementation cost of my design is a little bit higher as compared to the other design, because I am using smart sensors, and my smart sensors are to be calibrated one time as per the versatile changing environment. So my sensors can be classified as versatile sensors, and ultimately this can increase the implementation cost of the system, but overall running cost of the system is appreciatively lower as compared to the other designs. So lastly, I would like to thank my audience for listening to my presentation. This was all from my side as far as Smart RHM is concerned. So thank you very much, guys.